Centeno, and let's geek out a little bit on the transverse ligament here in this possible craniocervical instability patient from Germany.
Hey, before we get started, if you could like, share, subscribe, hit the notification bell, because that's how you pay this forward to other patients so that they can find this content.
First thing I want to say is give a shout out to Upright MRI of Hanover. These are beautiful images. In fact, Europe, I think, has better tech for upright MRI than we do here in the United States, because our upright MRI images are never this crisp and pretty. So shout out to Upright MRI of Hanover. Down here, we're looking at Translational BAI, but they really didn't get enough flexion and extension to make a go of this. So the Translational BAI looks normal. This is an attempt to do right and left lateral bending to kind of replicate what we see in DMX, open mouth AP views, but they don't get enough lateral bending to make a go of it. And then we have these rotational images, which are common in Europe. The problem with rotational images is that you need to see greater than 56 degrees of C1, C2 rotation based on Dvorak 1987 paper, but you rarely see that. And some surgeons will use 44 degrees. That doesn't appear to be scientific or science-based in anything that compares normals to controls. So these are rarely useful, but here they might be useful. They're rarely useful for looking at too much C1, C2 rotation. But here we tend to see that the transverse ligament here looks a little thinned. And there's fluid in the upper cervical bursa, so it looks like this could be a small tear here. Now, the problem is that we don't have thin slices here, but again, it looks like there could be a transverse ligament issue here. Looks like there could be a transverse ligament issue there. So we're seeing it in at least two slices, which is helpful. On the other side, so this is head turn to the right with head turn to the left. We see some thinning, but the transverse ligament tends to go up. These are thick 3 millimeter slices, so hard to tell. So bottom line is there could be a transverse ligament here, or transverse ligament injury on the left here. And I think this gentleman now needs movement-based imaging. This would have been good down here with ADI and flexion, but we don't have enough flexion to make a go of it. So he needs good old-fashioned cervical flexion extension x-rays to try to see if this transverse ligament, when stressed, is unable to keep the C1 and C2 bound together. So that would be opening of the Atlantodental interspace in flexion. So he's going to get that imaging, and we'll see how the transverse ligament does. But this image is suggestive of a possible transverse ligament injury, which is how it was read out. And again, big shout out to Upright MRI, or in German, MRT of Hanover, because these are beautiful upright MRI images, much, much better than the ones we see in the States. So I'm not sure if they're using different equipment or different techniques, but very nice images. Thanks so much for watching, and have a great day.